Thank you. Good afternoon, everyone, and thank you for joining us here today as we announce changes to our public health measures. I want to start by thanking residents, businesses, Indigenous leaders, and community governments for their continued efforts to limit the spread of COVID-19 in the Northwest Territories. When we look back on how we handled this pandemic, it'll be remembered that we came together as a territory for the common goal of protecting the health and well-being of residents, especially those most vulnerable. The last year has put us all to the test in ways that many of us have never experienced before. We've always been committed to relaxing restrictions when the evidence was there that we could do so in the safest manner possible. For the last 12 months, Dr. Kandola and her team have been hard at work understanding the many factors that need to be taken into consideration when making evidence-based decisions rooted in science. I have full confidence that she continues to keep the best interests of residents and our territory in mind as she makes decisions. Today, we are pleased to announce changes to our public health measures that take into consideration our social and economic recovery as a territory. The first change will be around self-isolation requirements for territorial residents. If you have received both doses of the vaccine and you produce a negative test result on the 8th day, you will not be required to finish the 14 days of self-isolation. As well, all members of your household who have both vaccine doses will not have to self-isolate if you return from out-of-territory travel. This change reflects the protection that is provided by vaccines, and I encourage all eligible adults to get vaccinated. It's the most effective weapon we have to stop the spread of COVID. Self-isolation has been one of the biggest success stories of our fight against the spread of COVID-19, and we wouldn't be standing here today making this announcement if residents hadn't followed our orders. Thank you to everyone who has played a part in making this happen. The second change is related to one of the hardest hit sectors of our economy, tourism. Today, we're announcing changes that will allow remote tourism operators across the Northwest Territories to begin planning to host out-of-territory clients at their remote locations this summer. These changes are being announced now to allow tourism operators the time to plan and ensure they have an approved plan in place to host visitors in a way that will minimize any contact with territorial residents and communities. This will benefit more than 60 operators in the Northwest Territories and provide opportunity for economic recovery after what has been a very difficult year for our world-class tourism sector. The pandemic has brought into sharper focus the urgent need to act on social and economic development. Like every other jurisdiction, territorial residents and businesses were asked to make huge sacrifices to help protect the N.W.T. from COVID-19. While we have largely escaped the worst of the health impacts, territorial residents did suffer economic, financial, and social losses, and the government of the Northwest Territories is committed to helping the territory recover from them. This is one step in our efforts to help come back stronger than before. Many of the efforts of the pandemic were a result of social and economic gaps and challenges that existed before the pandemic and which the government has already working on to address. Continuing that work and accelerating it where it makes sense is going to be a key part of how the government helps promote recovery. We are committed to working on the social and economic recovery of the Northwest Territories, and this is one step forward in what we hope will be a number of changes in the coming months. Dr. Kandola will provide more details momentarily, but before I turn it over, I want to talk about our vaccination strategy and the importance of getting vaccinated. We are in the 4th month of our vaccination rollout, and to date, Our vaccine teams have visited all 33 communities. As of last week, all communities have had 3 visits to offer first or second doses of the Moderna vaccine. Since late last December, our focus has been on the execution of our vaccination strategy and our efforts to create the most protection possible for Territorial residents. While we have had promising uptake across the Territory, we still have work to do to support our goal of herd protection. So I ask that all residents who have not been vaccinated yet to book an appointment, please, and get vaccinated. If not for yourself, for your loved ones, for those in your communities that can't take the vaccinations. We need everyone who is eligible to get vaccinated so we can get back to doing the things that we love in our communities, like larger sporting events, community gatherings, feasts, and hand games tournaments. By getting vaccinated, we protect our children, fellow community members, our elders, and the Territory as a whole. Strong community immunity through vaccines is vital to our return to pre-pandemic activities. If you need more information, please visit www.gov.nt.ca/COVID-19 and learn more about the Moderna vaccine. It's important that we all have the information we need to make the best decisions. So please visit the website or talk to your healthcare provider. Though the N.W.T. may be fortunate to be a leader in vaccinating residents, this doesn't mean that our risk to bringing the virus into the Territory is gone, and we'll need to wait for the rest of Canada to catch up to us. Continuing to carefully manage our response as we emerge wisely is essential to ensure the health and safety of our residents and our communities. On that, I'd like to now turn it over to Minister Green to provide some brief opening remarks. Thank you.
Good morning, everyone. Thank you, Premier Cochrane. I would first like to provide an update on where we're at with the COVID-19 vaccine rollout. The N.W.T. has been vaccinating both residents, as we know, as well as non-residents who are working in mines and on petroleum projects, in the N.W.T. following recent COVID-19 outbreaks. And since the beginning of the rollout, the CPHO has been considering requests from other non-resident rotational workers or new residents who want to get vaccinated. We are in an enviable position. Many of our southern neighbours will be waiting into the summer to get a dose of the vaccine. Today, the N.W.T. is releasing regional and territorial COVID-19 vaccine coverage data on the N.W.T. COVID-19 dashboard. Vaccine coverage data will be uploaded to the dashboard every 2 weeks from today. At this point in our being informed about the level of vaccine coverage in N.W.T. regions reinforces our collective responsibility to protect both communities and the territories. The success of our COVID-19 vaccination program relies heavily on residents' willingness to be vaccinated. As of April the 17th, 25,375 first doses have been administered, and 19,271 people are fully vaccinated against COVID-19 with their second doses. Overall, this translates to 63% coverage for first doses and 51% of adults who are fully vaccinated in the N.W.T. While these numbers are impressive, there is still work to do. We are starting to see a lull in our vaccine uptake, just as the first confirmed cases of COVID-19 variants are arriving here. These variants are highly infectious and deadly, even in young, healthy people. While there are measures in place that have worked well to protect us from COVID-19, the virus still finds its way into the territory through travel. Now is not the time to be complacent. I want to take this opportunity to urge anyone who has not yet received their vaccine or anyone due for a second dose to contact their local health care provider or health center to find out how to access it. Getting the COVID-19 vaccine will protect you against severe disease and death. You will be offering increased protection to your family, community, and the whole territory. At this point in our rollout, we are beginning to transition back to regular vaccine delivery following the excellent work completed by our traveling vaccine teams. Vaccine will be stored in regional hubs and can be accessed by appointment. Residents in smaller, more remote communities who may have missed previous vaccine opportunities can call their local healthcare provider to request a first or second dose. The data I just spoke about shows the highest vaccine uptake is among those aged 65 or over, and the lowest is among those aged 18 to 29. I want to take this opportunity to ask residents to help bring the number of vaccines up among young adults. If you have a young adult in your life, a child, a niece, a nephew, a coworker, a friend, who is still on the fence about getting vaccinated, please start a conversation with them. Those of you who have already been vaccinated are our greatest ambassadors. Younger adults are very susceptible to severe illness or death from COVID-19, especially with the new deadlier variants now in circulation. We know that some of the residents in the 18 to 29 age group are students who are currently out of the territory for education. All adult students are eligible for the COVID-19 vaccine once they return to the N.W.T. and complete their 14-day isolation period. Students who live in Fort Simpson, Fort Smith, Hay River, Inuvik, or Norman Wells can contact their local public health unit to arrange vaccination in their home community. Those living in Yellowknife can book online. N.W.T. students returning to smaller communities outside of the regional centers who would like to get vaccinated must email cpho@gov.nt.ca and provide their full name, their contact number, their home community, the community they will be isolating in, and the date of their arrival in the N.W.T. The Office of the Chief Public Health Officer will arrange to vaccinate these students before they return to their home community. We've also been hearing through our on-the-ground outreach teams that some people may be hesitant to get a second dose because they've heard side effects may be more common than they were with the first dose. Although the first dose is very effective, the second dose of the vaccine ensures stronger and longer-lasting protection. Side effects are usually mild to moderate and typically last only a day or two after vaccination. Lastly, we will continue to reduce barriers wherever possible to ensure as many residents as possible are fully vaccinated with both doses of the Moderna vaccine. Anyone who missed initial vaccine clinic opportunities in their home community is allowed to get a dose in another N.W.T. community where appointments are available. For those who have been asking for walk-in hours and mobile clinic opportunities in alternate locations, we listened. This past weekend, we ran a successful walk-in clinic at Yellowknife Co-op after hearing from residents that another option was needed uptown. We will continue exploring other opportunities for mobile clinics like this, especially in our regional hubs. I'd like to thank everyone who has been vaccinated so far for doing their part to protect themselves, their community, and the territory. I'd also like to remind everyone that now, more than ever, it's important that we continue to follow the advice of the Chief Public Health Officer. Strong vaccine coverage in the N.W.T. is one of the main ways we can get back to doing the things we love. I'd now like to call on Dr. Cami Kandola, the Chief Public Health Officer, to provide remarks. Thank you.
Good morning. I am pleased today be able to introduce changes to our public health measures. These changes will reduce self-isolation requirements for individuals who are fully vaccinated against COVID-19 and provide an opportunity for N.W.T. remote tourism operators to host out-of-territory clients. Before providing additional details on both changes, I want to speak briefly about where we are currently in our pandemic response in the Northwest Territories and point out how that response is tied to what is happening outside N.W.T. borders. We are continuing to learn more about this virus and its variants during the pandemic, and as evidence emerges, we are changing our response to reflect what we have learned. What we know now, we did not know 12 months ago. For example, any anticipation that vaccines could be the silver bullet ending this pandemic has changed due to the emergence of variants of concern that are fueling a third wave across Canada and other parts of the world. While we continue to offer the vaccine to all N.W.T. residents who are eligible, we must be mindful that what happens beyond our border is beyond our control, but it does matter. This pandemic is not over here until it is over everywhere else. We as a country are in this together. That is why we must continue to ease restrictions in a measured, step-by-step approach that follows the current scientific evidence. That is what we have done today. Self-isolation has been one of the pillars of our COVID-19 response. It has helped keep our residents and communities healthy and safe. But there is also no denying self-isolating for 14 days is not easy for some people. The change announced today means if you are fully vaccinated and have traveled domestically out of the territory and are not traveling with an unvaccinated person, you will still have to self-isolate initially. However, now you can take an approved COVID-19 test on or after day 8 of your self-isolation. If that test comes back negative, you will no longer have to self-isolate. You will have to wear a mask in public spaces for the remainder of the 14 days and isolate if you become symptomatic or if you have been named as a contact of a COVID-19 case. What's more, anyone in your household who is fully vaccinated will not have to self-isolate at all when you enter the N.W.T. from out-of-territory domestic travel. Anyone who is not fully vaccinated or isolating with a non-fully vaccinated traveler will still be required to self-isolate for the full 14 days after entering the Northwest Territories from out-of-territory domestic travel. So what does fully vaccinated mean? It means it has been 2 weeks since you have received your full dosage of vaccine product. For most N.W.T. residents, that means 2 weeks after your second dose of Moderna vaccine. Also, I want to point out that this change will not apply to anyone entering Northwest Territories from international travel. International travelers will still be required to follow the federal government's quarantine rules, even if they're fully vaccinated. I'm hopeful easing our self-isolation requirements for people who are fully vaccinated will reduce some of the burden of self-isolation our residents have been bearing, while also encouraging more of our residents to do their part and get both doses of the vaccine. I also want to stress that even though we are easing our self-isolation requirements, non-essential travel is still not recommended right now. Canada is in its third wave, and additional importation risks are still a concern for those N.W.T. residents who are not able to receive the vaccine, and that includes children and those with allergies. If you must travel, even if you're fully vaccinated, the risk of bringing COVID-19 back into the territory, especially a variant of concern, is still real. We need to learn more about how effective the vaccine is against transmitting the virus to others and protecting you from these variants. The good news is it's much less likely after vaccination. There is strong evidence the Moderna vaccine is very protective against the B.1.1.7 variant, which was first identified in the United Kingdom. This is just the first step, and as vaccinations increase in the Northwest Territories and transmission rates decrease outside the Northwest Territories, I do hope to be able to continue easing restrictions. The second change we are announcing today will allow remote tourism operators to host out-of-territory clients at their remote locations this summer. To do so, they will need to submit an operations plan and have it approved by the Office of the Chief Public Health Officer. In that plan, they will have to be able to address how clients will be brought into the Northwest Territories to self-isolate at their remote location and to ensure that there's no or very minimal contact with N.W.T. residents and communities. These out-of-territory clients will not be arriving until the summer. By then, vaccination rates nationally and globally will look much different than they do now. More people in our territory will also have received either their first or second dose of the vaccine by this summer, giving them strong protection against the virus. So why are we announcing this change now? It's because remote tourism operators need these couple of months to work through logistics to be ready to accept clients this summer. Remote tourism operators must include detailed plans for managing clients and employees from arrival to the Northwest Territories through to departure. And they must be able to keep clients and all workers self-contained to the remote location or area identified in their operation plan. Out-of-territory clients will still need to submit or file a self-isolation plan with a travel exemption before they can travel to the Northwest Territories. But instead of isolating in one of our isolation hubs, they will do it in a remote tourism location far away from our communities. I recognize the public health measures we've put in place have been challenging for the tourism sector. This innovative plan will allow remote tourism operators who employ and use the services of many Northerners to proceed with accepting out-of-territory clients in remote locations, while at the same time providing the necessary safeguards to protect our residents and our communities. As my office continues to work on updating Emerging Wisely and releasing it in the coming weeks, we hope to be easing more measures. And if things go well, eligible Northerners continue to get vaccinated, the third wave subsides nationally and globally, and we learn more about the vaccine's effectiveness against variants and transmission, changes like we have announced today will continue to occur. If things do not go as well, those changes will be more gradual. We can't put our territory's hard-won stability and our people at risk. Today's announcements might seem like small steps forward to some, but we are still moving forward. This is in stark contrast in what we are seeing in other jurisdictions today. So let's continue to be patient, optimistic, and part of the solution by following our public health requirements and measures so that one day we may get back to normal. And together we can defeat COVID-19. Thank you.
Thank you very much to our speakers. This is certainly a lot of information for people to digest. And of course, Cabot Radio and CBC are both streaming on Facebook. There are a ton of questions for our residents at home. We just want to reassure you there are some pretty substantial FAQs, backgrounders, Q&As that have been circulated. Those are on the COVID website as well as the Cabinet Communication Facebook page and newsroom site. So if you've got questions that are not answered here today, please do not hesitate to head there to get those questions answered for you. So we'll open the floor now to questions. Reminder, we also have Donna Lee from N.W.T Tourism here and Sonia Saunders who can answer some operational questions, as well as Dr. Pegg. And we'll get started right away with Luke from CKLB.
Hi. So yeah, my first question is just how are people going to prove that they do have their full vaccination when they don't have, like, they didn't get documents when they got vaccinated?
So Dr. Pegg.
Thanks for that. So for Northwest Territories residents, it's possible to go to the N.W.T or the NTHSSA website and follow the links for a request for health information and to specify immunization records. And those records can be sent electronically with a copy of government ID that goes along with that request. For out-of-territory residents, we're working with other jurisdictions to look at what type of documentation presented by other provinces, territories, and potentially other jurisdictions would be acceptable as a proof of immunization document. Without getting into the whole idea of a vaccine passport, it would be a territorial or provincial health document that indicates vaccine.
Like, I know hindsight's always 20/20, but looking back, is there any wish that maybe there was some sort of documentation that went to every N.W.T resident who did get their vaccine?
We considered that. Again, since we're not sure what will constitute official vaccine validation, authorization, proof of vaccine, Canada-wide and potentially internationally, we did opt to not provide that just to avoid having to go back and potentially reissue a second document for people in the event that the document that we landed on initially would not qualify as that proof of vaccination.
Natalie.
My first question, I think, is for Dr. Kandola. I'm just wondering, with these new measures of the remote tourism, is there any concern that that is going to increase the number of positive cases coming into the territory, especially with the variants rising down south?
So right now, the federal government has travel restrictions internationally and with the U.S. So travelers that will be coming in will be coming domestically unless those are lifted. And what I know with the vaccine supply is that we anticipate that everyone should, in the rest of Canada, should be offered at least one dose of the vaccine before June 30th. So as the remote tourism operators plan, they're planning for the summer, and I anticipate at that time the third wave will be bent, we'll have a high vaccine rollout, and the risk of introduction will actually be much less than right now. Just a clarification on the CKLB question, we have, if anyone has received their vaccines in the Northwest Territories, it is captured in the electronic medical record. And so if people are receive the vaccine here and are going to get tested on day 8, that can be validated that time in the electronic medical record that they received the 2 doses, and they'll be off with the test at that time. Thank you.
Further to the tourism announcement, I'm not sure who exactly this question would be for, but I'm wondering if someone might be able to speak to the ways that the tourism operators are being engaged to ensure that this is being conducted safely.
So we'll maybe let Sonia Saunders respond to how they were engaged with through this process.
Good morning. Thank you for the question. We've been actually working very closely with Northwest Territories Tourism, and so Donna Lee DeMarca is here from that organization. Working with them, they had also retained the services of a doctor to help provide input into sort of what would be needed. We worked very closely with the Office of the Chief Public Health Officer, and then we developed a template that the people would use to make a submission for approval to operate this summer. And we then went did a pilot project with a couple of operators to go through and see how well that would work, working with the Office of the Chief Public Health Officer. And finally, over the last couple of days, we've had confidential workshops with the remote tourism operators to go through the process with them, go through the documents that are required to be filed. And now that the announcement has been made, they will be in a position to complete those applications and submit them. Thank you.
Thank you for the question. Kevin?
Hi, what was behind the decision exactly to reduce the self-isolation requirement? Was there a threshold that was hit in terms of the population that was vaccinated? Was there like a number that was hit that made the decision kind of happen? And what was the reason that the date that, or the amount of dates that was chosen was 8 days after?
Dr. Kandola?
That's an excellent question. So we've been looking at studies or real-world data around the effectiveness of messenger RNA vaccines or vaccines in general in reducing not only symptomatic transmission but asymptomatic transmission. And so we've looked at data in Israel where they've shown a 90% reduction, and some of the studies that have been done in the US that have also shown a significant reduction in asymptomatic and symptomatic transmission, enough for the Centers for Disease Control to change their own policies. So that was, I'm watching also the number of cases go down significantly in real world experience with countries that have high immunization rates gave us that added assurance. And the second is we combined it with modeling data where we know that with COVID, that the vast majority of cases people become symptomatic in the first 5 to 7 days. We felt that given the high level of variants and the third wave we're experiencing in the N.W.T, at this point it'd be prudent to put in that 1 week isolation, knowing that along with a significant reduction being fully vaccinated, that if they were to present either with an asymptomatic or symptomatic infection, it would be that first week. And then the additional other reassurance is to do a PCR test on day 8, and that could pick up any asymptomatic cases. With all those measures in place and what we're seeing in countries that have rolled out high levels of vaccination coverage, we feel that that would be a good enough analysis and background to say that by the second week, the risk of that fully vaccinated individual having isolated, having a negative PCR test is minimal enough that they can self-monitor. As the third wave goes down and as vaccine rolls out, we will look further into the self-isolation requirement of a week. Thank you.
As well, a couple months ago, you guys were talking about the full herd immunity, being able to reach that by the end of March, and then last month you guys were talking about reaching that by the end of April, and we're now almost at the end of April, and we're only at just over 50%. Is there anything that you guys think you need to do more to? You mentioned that it was like a lot of the younger people that aren't getting the vaccines quite as much as the older. Is there any messaging like that you guys are going to put out or try to be more proactive in getting these people vaccinated?
So this is an excellent question. It's a question that's been asked by a number of people. In the beginning, back in September, October, when the federal government was approaching the territories and provinces about our vaccine allotment, we had the classic COVID. No one knew about the variants of concern, so we were building it on the infectiousness of the wild-type coronavirus, and we felt that asking for enough vaccines to vaccinate 75% of our population in the first quarter would be sufficient to slow down the spread and slow down the impact on the healthcare system. Unfortunately, as we received our first doses and first shipments of the Moderna vaccine in late December, we also had our first introduction of the UK variant. When the variants were introduced, and they were introduced simultaneously in quarter one as we were rolling out the vaccines, as we learned more and more about the variants is that their infectiousness has increased by 50%. They have higher rates of hospitalization, higher rates of ICU admission, higher rates of death. and with the P1 variant, that it can actually reinfect people who have already been infected with COVID. Has the variants of concern changed our assurance that 75% would give us the herd immunity? And so we've asked for additional shipment come this quarter to be able to provide enough vaccines to get to 85%, and also to provide enough vaccines. What we noticed was there were a number of out-of-territory workers in N.W.T. who are not N.W.T. residents that we were also vaccinating. So we asked enough vaccine to be able to go to 85%, enough vaccine to vaccinate our out-of-territory workers, which about 6,000, of which we provided 4,000 the first dose. But we realized that this is the target we'd like to reach, but we need to move away from a fixed figure of reaching herd immunity, because at this point, with the variants of concern, it's very difficult now to say what that number would be. And where we're going is more herd protection. Is we're going to try to vaccinate as many people as we can vaccinate, but we can't reassure those people who are not vaccinated that a certain number means that they would be safe, that they wouldn't have risk of COVID. The population 18 to 29, when you go on the immunization dashboard, their levels are quite low. So what does that mean? It means that outbreaks can still occur in that population. It can still be a strain on the healthcare system, and we just have to keep that in mind as we move forward when we are presenting our Emerging Wisely plan, is that we will relax restrictions, but we don't have a safe coverage now to say that if you're not vaccinated, at this percent, you'll be safe from getting COVID. All we can say is the best way you can protect yourself from COVID, if you're eligible, is to get vaccinated.
Thank you. We're going to ask a couple questions that I've noticed a theme online. I think they're for Dr. Pegg. Dr. Pegg, can you tell people watching at home how long they should expect to get their results after their day 8 COVID test? Is it same day or will it take a number of days?
Thanks for that. Certainly that's going to depend on demand and the number of people who are requesting tests. What we're advising is that anyone who knows that they're going to need a day 8 test is that they book it as soon as they know what date that day 8 will be. If you're in a big center, you can do that by calling the health center or public health department. In Yellowknife, you can book it online through the NTHSSA website, nthssa.ca/COVID testing. And in smaller communities, it's through the health center. We are able to provide point of care testing that gives results in about 15 minutes that will then have a confirmatory PCR test sent. At this point, our turnaround time is still about 24 hours, but certainly that could go up a bit if demand is significantly increased from what it is now, or if we are required to respond to an outbreak or an increased wastewater signal. So my best advice would be, once you know what your day 8 is to book that test early so you're insured to get it as close to that day 8 as possible, if not right on day 8. And ideally, we'll be able to keep our turnaround times quite low.
Thank you. And I believe the next one's for Dr. Kandola. Dr. Kandola, can you clarify for residents at home, if you have kids who are not vaccinated, does day 8 test option apply to that household?
So if you're fully immunized and you come home, if you have unvaccinated children, they still need to isolate with you. If your day 8 test is negative, they no longer need to isolate. However, if they're traveling with you and they're unvaccinated, the order doesn't change. Someone who's unvaccinated still has to do the 14 days isolation. And with just a clarification, we do have a test that's a PCR ID now, and if that test is negative, because it's not, the PCR is not, the laboratory PCR is not available, it's only available in Stanton, but in the other communities, if the ID now molecular PCR is negative, that would be sufficient to release people on day 8.
Thank you, Dr. Kandola. Okay, we'll turn now to Marie Soleil.
Well, the question might be for Dr. Kandola. As I understand, under current travel restriction in place in the N.W.T, leisure travel by non-W.T resident is not permitted, but it will be for the ones who are going in remote regions. Well, it could be maybe for Cochrane, Prime Minister. So aren't we actually creating two classes of tourism? One class for the tourists who can actually pay for a remote location and go in these like remote sites with the operator, and the other tourists who can't come to the Northwest Territories because they cannot afford this kind of tourism.
So with the remote tourism operators, the reason why, from a public health risk point of view, it is low risk is because they're not coming into the communities, and they have to provide a detailed plan, which also includes a medical evacuation plan for us to take on this increased risk. At this point, we cannot encourage tourists to go directly in the community. It's not part of the order. This approach of having the responsibility go on the remote tourism operator to provide an approved plan with all the assurance of medical coverage and an ability to contain is a minimal risk. And so this type of tourism operator is not just specific to lodges, but it could be paddling groups. They have to apply for, they have to provide the operation plan, and if it's approved, they can go ahead. It's more from a public health risk perspective. What plan is going to put the least amount of risk of having tourists interface with communities? And that's the focus of this remote tourism order. It's about submitting a plan, having it approved, and being able to deal with any potential issues around having to do with a medical evacuation and making sure that there is no interface between the communities and the tourist locations.
And for those out of territories visitors, why don't you ask them to be fully vaccinated? Why don't it is required?
We have not made vaccination mandatory. It's and it's not mandatory in any of the other jurisdictions. For us, it's about providing information and having people making an informed decision. There are people also who are unable to take the vaccine or have allergies to the current vaccine. So the approach has always been in providing information, responding to questions, but not being coercive or making this mandatory.
Thank you, Dr. Kandola. We'll stay on this tourism theme for another couple minutes. Another online question for Donna Lee, I believe. Can you give residents at home a sense of what involvement N.W.T. tourism had in the changes being announced today? And are you happy with the announcement? And probably, I'm sure media would love to know whether or not operators seem happy with this as well.
Thank you for the question. N.W.T. Tourism is very grateful to have been able to work with the DNWT through this, specifically the COVID Secretariat, Environmental Health Officer, ENR, ITI, and of course the Office of the CPHO, who've all worked really, really hard to make sure that there's a safe path forward to slowly restart tourism in the Northwest Territories in a manner that's safe for our residents and our visitors. This announcement allows roughly 60 of our operators out of our roughly 150 operators to start making a plan and start putting a plan in place to open safely this summer and welcome visitors to their remote locations this summer. Thank you.
Sarah, Cabin Radio.
What about changes to like outdoor gatherings and increased capacity of businesses? When will we see changes like that coming?
So Dr. Kandola, I'd say that's probably emerging wisely.
So today we announced the orders for the self-isolation and remote tourism, and the next order that we're working on is around merging wisely. We will have a plan available for consultation by the cabinet end of April, early May, and we'll be working first on the outside order, but the plan will provide the full plan, and that should be available after we receive cabinet communication feedback and in May, early May.
And then on the tourist thing, we also have questions about people, asking if tourists can come and camp if they're like isolating on their own, like a tent or a camper. Does that fall within the kind of remote tourism piece?
So with the remote tourism, it has to be a plan submitted by a COVID operator, and the plan is quite detailed and includes medical insurance. And so I think the best thing is to look, when you're looking at the requirements of what we would need in terms of the operation, is to look at the FAQs that you've been provided and look at what our requirements are. And we have to have that plan approved before people can entertain out of territory visitors.
John, CBC.
This question's for Dr. Kandola. Question is, the Territory is not recommending non-essential travel, but it's now allowing non-residents to come in and, self-isolate remotely through this tourism. Something earlier on in the pandemic, residents here weren't allowed to do. So maybe you could just explain why that change was made now, and will residents here be allowed to self-isolate remotely?
So in our order, our travel restriction self-isolation order, we have put in a recommendation that non-essential travel be avoided, especially into the communities. From a public health risk point of view, we are considering for the summer allowing non-essential travel or tourism in remote locations after approval of a COVID-19 operations plan. This is in anticipation. In the summer, we will see vaccine rollout in the rest of Canada. We'll see a bend in the third wave. However, opening up tourism directly into the communities will be a higher public health risk, especially during the third wave. And so, as the third wave bends and as the vaccines roll out and the risk is lower, we can look at opening up other measures, such as non-essential travel. But right now, we're providing this order to allow a lower public health risk of people in very remote locations to plan for the summer. And as time goes on, we will be looking at specifically opening up later on for the communities. But at this point, opening up for non-essential travel during a third wave that has not peaked would introduce a larger importation risk than having someone isolate in the wilderness.
I have a question about long-term care visits. If someone's fully vaccinated, when can they expect to be able to visit a long-term care facility?
Long-term care.
We have been working closely with the Office of the Chief Public Health Officer to look at how best to address visitors in long-term care facilities. At this point, it's mostly on a case-by-case basis for individual visitors with regards to the risk profile of the person that they're planning to visit and the activity that they're planning to undertake. But that is actually something that's actively under review right now, particularly as these new orders have come in, is how we can better open up visitors and improve the quality of life for those living in long-term care facilities.
Minister Green, would you like to touch on that as well? Okay. Okay, thank you, John. Mario.
Hi, my question is probably for Dr. Kandola. As we're seeing, as you're reviewing the emerging wisely, as we're seeing vaccination rates rise up, are we expected to see more of these measures in place specifically for vaccinated people as we're reviewing the plans? Like, can we expect more and more of these measures?
So we do know that with fully vaccinated individuals, that their risk of symptomatic and asymptomatic COVID-19 infection reduces significantly. Where that has played is in evaluating the public health risk of them coming back into the territories, and so it is a lot more reduced than non-vaccinated. But our aim for Emerging Wisely is to put in public health measures for everyone. And so where we would see scenarios where the risk is lower for fully vaccinated individuals is when you're looking at congregate settings or high-risk settings. But in our Emerging Wisely plan, we're not making a distinguishing between vaccinated and unvaccinated. We want N.W.T. to be a safe place for everyone.
Probably a question for N.W.T. Tourism to hear a bit more about. You mentioned this is good news. This is going to let a bit of operation. So what are you specifically asking now? What your talks with the governments? Like what is the industry at? What's the next priority now?
Thank you for the question. Honestly, this was our focus for right now. Our next is, of course, to continue working for the rest of our operators who don't fall under this plan. And really, the only kind of thing that we can work for them right now is to continue some of the supports for them that have been in place from the federal government and the territorial government until they can be in a position where they can go back to work again as well. So, and receive visitors to the territories as well. Thank you.
Thank you, Mario. This one for Minister Green. Minister Green, we've heard today that we are essentially no longer committed to a specific target number for vaccine coverage, but we know that the high vaccine uptake is, of course, one of our main factors that is within our control and will help us to get back to the things we love to do. Can you tell residents kind of what some of the activities are that the Department of Health and Social Services is doing to help increase that vaccine uptake?
Yeah, thank you. We are working with Indigenous governments, MLAs, and community governments to create solutions that work in their communities. What I hear is that people are sometimes inspired by seeing leaders have their vaccines, and so taking pictures and posting those is important. Some people are interested in short videos like TikToks that would reach out to that target group that we know is under-vaccinated. So we are also addressing the convenience issue, and so we did that with the pop-up clinic at the Yellowknife Co-op last weekend, and I think there are plans for more of the activities that will bring the vaccine to the people. The complacency where people feel that we have very little COVID in the territory and so they don't need to be worried about it. We're trying to promote the idea that they will have more freedom to move around within the territory and within the country if they are fully vaccinated. And then the last one is probably the most difficult one, which is confidence in the vaccine. So we are telling people, and it is a fact, that Health Canada has approved these vaccines and that the negative side effects are rare and they are mostly all very manageable. There are only a very few cases of people having very severe side effects. So despite a lot of misinformation that's available online, we're really promoting the fact that health professionals have okayed this vaccine for use, and that we have very few negative responses in the country as a whole to the vaccine. So we are encouraging, of course, everyone to get vaccinated. Thank you.
Thank you, Minister Green. A question online for Dr. Kandola that I think it's important we answer or clarify. If somebody is approved from out of territory, for example, for compassionate travel, will they be allowed to have the D8 test as well? So can we clarify that one?
There will be people, essential workers or people who have been approved for compassionate exemptions who are fully vaccinated, and so they would need to provide proof of their immunizations to access the day 8 test.
Thank you. And to close us off today, Premier Cochrane, can you please give us a message to N.W.T. residents and staff after over a year living in the COVID-19 pandemic?
I guess to close us off, what I'd like to say to everyone is a huge thank you. People often say, you know, is it Dr. Kandola, is it the Premier, what's going on, who's doing it? It's not either of us. It's all of us that have done this together. Residents who have obeyed the orders, businesses who have made huge sacrifices, Dr. Kandola and myself, but hundreds, if not thousands, of government employees have worked around the clock to make sure that the residents of the Northwest Territories are as safe as possible. And our hard work has paid off. We're one of the best jurisdictions, if not the best jurisdiction, in the whole of Canada. So again, it hasn't come without a cost. I recognize that. Every single person in the Northwest Territories has been affected. And for those of you who have sacrificed so much, a sincere thank you. Your efforts, all of our efforts combined, have brought us to where we are today. I cannot thank you enough. Thank you.
Thank you, Premier Cochrane. All right, we'll close it there. I'd like to thank Premier Cochrane, Minister Green, Dr. Cami Kandola, Dr. AnneMarie Pegg, Sonia Saunders, and of course Donna Lee from the N.W.T. Tourism for joining us today for this announcement. As I said earlier, there is a ton of information here, but we've got lots of stuff online for you. There are some FAQs, backgrounders, and the COVID Secretariat has produced some nice sort of cheat sheets for our residents at home to better understand the self-isolation requirements. So thank you again for being here. Media, you know who to email if you've got follow-up questions. And everyone, please enjoy the rest of your afternoon.